Innovation, imagination, wonder. These are just some of the words used to describe Dr. Harvey Passes. Dr. Passes explores interesting people and ideas that will stimulate you. He questions the people who develop, create, and employ novel concepts in business and everyday lives. He especially loves to speak with successful people. How did they do it? How can you do it too? So let's join Dr. Harvey Passes in his quest of wonder and curiosity as we watch Dr. Harvey Passes Presents.
I've got some story to tell you today. Sit back, relax. If you like a good story, you're in for some tale. It all began one night while I'm having dinner at a lovely local restaurant in Port Washington, and one of my boys gets up and goes to another table and sees someone that he knows from school and starts to chit-chat, and the kids are playing Game Boy and all that kind of stuff. And I asked the people sitting at the table, the mother and father, I'm sorry, I'd say to them, if my son is bothering you. And they say, no, that's okay. They know each other, and that was great. And we struck up a conversation. And the gentleman who you're about to meet told me a story that my jaw just dropped open and I couldn't close it. It was just an amazing story. As a matter of fact, if you think that we have a miracle mile in Manhasset, well, you're going to know that there is a greater miracle that happened in Manhasset. And you're going to meet the Miracle Man, who had the most amazing tale of surviving that you've ever heard. First, let me introduce you to two very interesting people. Rich Bentley. How are you, Rich?
Very good, Harvey.
It's great to see you, and I know as far as you're concerned, it's great to be seen. Absolutely. Let me tell the folks at home a little bit about your background, which actually, you're not even going to be talking about your background today. We're talking about what happened to you, but you're the Director of Administrative Services at SUNY, State University of New York, downstate in Brooklyn, which means you probably handle a lot of stuff at the higher level, making sure things run and things work.
All the logistics on both the academic side of the colleges of medicine, nursing, health-related professions, and graduate studies, a lot of research activities, and University Hospital of Brooklyn, which is a 375-bed hospital in East Flatbush, Brooklyn.
Wow. So you're a busy guy. You're a busy guy. Seated next to you is a very pretty lady who's got a very lovely smile. I'm a dentist, so it's a professional thing I'm telling you. You got a nice smile. Okay? It's a professional opinion. Kathy Citarella. Kathy,
hi,
it's a pleasure for you to take time off of your schedule to come down and help get this story out, which is a tremendous story of hope and other things which we'll get into. Kathy is a physical therapist, and she's part of an organization called Professional Physical Therapy in Great Neck.
Yes.
And it's just an amazing tale. So let's get right down to it. Your story began, is it this past summer?
Late summer, actually, September the 9th.
This past September 9th?
Yes.
Where were you?
Beautiful, beautiful day at Jones Beach.
Beach.
You couldn't ask for a more picture-perfect day. We were out there with my wife, Patty, and my two sons, Kyle and Sean. They're 10 and 7. And with another couple that have, Mimi and Larry Rivera, and their two children. We all went to the beach together.
Expecting it to be a lovely, routine day. And I'm sure you probably had plans for the evening of what you might do for dinner or something like that. Did those plans change?
Absolutely.
Okay.
Absolutely.
So go ahead. So you walk onto the beach.
And
what happened?
We as I say, it was a picture-perfect day. We went straight on Field 6 in Jones Beach. If you're familiar to it, we went there because it's a nice short walk to the water. We got a place right up near the water, and we did stay because we had so many kids with us between the flags that are lifeguard protected. And we spent the bulk of the day just jumping in the surf and having a ball.
Were there big waves?
It was 1 to 2 foot waves, so every once in a while you would get a rogue wave that might have been bigger. As a matter of fact, as we were playing in the surf, the kids were naming all the waves. Oh, this is a mama bear wave. Oh, this is a papa bear wave.
Oh, right, showing the size.
Yeah.
I see.
And that's how we spent the bulk of the day. We took a couple of breaks where we went up to the beach house and got lunch, came back, and the water temperature was perfect. It was just a picture-perfect beach day. As my son Sean says, it was perfect until the accident happened.
What happened?
While swimming in waist-high water.
Waist-high water. I want to make sure that that point is set.
It was waist-high water. I had already been in the water and was swimming underwater. Mm-hmm. I was facing the bottom, and I was heading out to sea as I was doing that. But I was just in waist-high water when the last thing I can remember telling myself was how beautiful the bottom looked. The bottom was just soft. There wasn't a rock in sight. There wasn't a seashell. And I just said to myself, "Oh, what a soft bottom. This looks so beautiful." When wham!
What happened?
A wave, evidently one of those nasty waves,
yeah.
An Uncle Fester wave.
Yeah, Uncle Fester, right?
Came in and must have just hit me at the point of my head and slammed me right into the bottom. And it wasn't...
While you're flat in the water, prone.
Exactly.
Wave came over, and you're heading out.
Right.
So the wave came over your head.
Took my neck and just threw me right against that bottom, and it wasn't nearly as soft as what it looked. It was like lightning bolts went off in your head, and that's when I was in the position of not being able to feel anything. All of a sudden, it's like, okay, I'm floating in the water.
But you can't move.
Let me just stand up. Oh, gee, I can't stand up.
Oh, my God.
Oh, gee, let me just get my thoughts together here. And as I'm getting my thoughts together and the time is ticking, I'm saying, gee, I can't move anything. I can't get my hand above the water to perhaps flag a lifeguard.
And you're under the water.
I'm under the water.
And holding your breath.
Holding my breath. And as the time began ticking more, I realized that I was paralyzed and there wasn't anything I could do about it. I could hear conversations going on above the water because this was a crowded day at Jones Beach, and although I was at the green-red flag portion of where the lifeguards are, we were spread out, but there were swimmers within, say, 20 foot of where I was, and I could hear all their conversations. And then the surf began to take me with the water.
So you became like a seashell.
Exactly.
You started to just move. You couldn't do anything.
I was just bobbing in the water.
But how were you able to breathe?
There's a song called Calling All Angels. Pretty rapidly, you realized that you were in trouble, and you began calling every angel you could think of, and doing a lot of praying. And I lucked out by having another wave just in the normal wave action bring me up to the surface, where I was able to gasp another breath. And I figured, oh, this is great. I'll just float here at the top of the water, and I'll just call somebody. Well, I was floating at the top of the water, and I went to call somebody, and nothing came out. I couldn't speak.
Really, you couldn't even talk.
Exactly. So at that stage, not being able to say anything to anybody, I just had to hope that somebody was going to recognize that I was in trouble. But I had enough time to get a good breath in, so another wave that came and took me back down to the bottom, and that happened twice in this cycle, where I was able to just, you do see your whole life go before you. You do start thinking, gee, did I buy enough life insurance? Is my wife and kids going to be covered? All of those horrible things that go through your mind. I had the chance to think about, gee, this is how it happens, where you just wind up going out to sea, and I'll wind up on the Jersey Shore next weekend or something like that, or how big will the fish be that has me for lunch?
You look like sushi for a fish.
And all of those thoughts do go through your mind, and I had enough time under that water to think about them all. Luckily, there was a nearby couple of Latino swimmers who maybe they just saw the reflection of I had a bright green bathing suit on. And all of a sudden I heard the words, "Hey, there's a guy down there. Yeah, he's in trouble." And they came running over to me, and that's when one of them shouted, "Hey, flag the lifeguard, call the lifeguard." And that's when they started calling the lifeguards, and that's when I got noticed. And it was, to this day, I don't know what their names were, but it was those people that actually
saved your life.
Pulled me out of the water and saved my life.
Now, as we go on with the story, and then eventually how Kathy comes into the story, and your doctor as well, the interesting thing here that I recall when we first spoke about this was that you're alive today because all the pieces just fit together, in your case, as to what should be done was done. And it all worked in a timely fashion and in an appropriate fashion. Is that correct?
From beginning of being saved at the point of the water until what we'll get to as the end of the story, everything fell into place and worked the way that it's supposed to, because there are so many things that could have gone wrong.
I want to discuss this chronology, this chain. So now, the lifeguards are coming, and they took you out of the water, or those guys who said, "Hey, there's a guy in trouble," took you out of the water?
Both. The lifeguards began to take me out under my arms, walking toward shore, and that's when my wife realized that it was me that they were taking out, and she began running out. The friend that I was with happened to be a retired police officer. They both ran out and helped the lifeguards in, and that's when they said, "He's got a neck injury." So they recognized right away, I guess, when they were asking me questions and I couldn't respond or I couldn't move anything, they knew right away that I had a neck injury. And as soon as my wife heard that, my wife was like, "Well, then let's leave him in the water. Don't take him out of the water." They were ready to take me to shore, because at that point I was huffing and puffing.
You'd snap your neck.
And
is that right?
Well, there's just more chance of injuring something and making it worse.
So she said, keep him in the water.
Keep him in the water.
How would they keep you in the water?
The main lifeguard took my body inside his. I was facing out, and he kind of pressed me against his chest.
No kidding.
And he sat in the surf with me sitting in front of him, and that's how we stayed while all the other lifeguards that began assembling. At this point, the tide was coming in, so they lined up their surfboards in front of us to prevent the waves from cracking on us, and that's where we stayed until
they came.
EMS, Jones Beach. You know, there's so many people I have to thank, because it was the couple that saved me. It was my wife and family who made sure that they kept me in the water. It was the Jones Beach lifeguards and EMS service who steadied me and kept me stable until the state police, Jones Beach State Police, arrived, and the state police was discussing with the EMS how they were going to transport me, and the state police wanted me to go by ambulance. The Jones Beach EMS service came in and said, "No, we've already taken care of that. The helicopter will be landing in 3 minutes. You guys have to clear the beach." I heard those words. The helicopter will be coming, and that's when I realized,
major.
We're not going out to dinner after after I just calmed down and catch my breath on the edge of the water.
And you couldn't say a word to anybody.
Yeah, and
you still couldn't speak.
I couldn't. If I got a motion or a word out, I don't know exactly what they were. My wife probably would be better at that. But if I got a word out, that was it. But I do remember, as soon as they said the helicopter is coming, saying, "Oh, this is bad. This is bad. They don't bring the helicopter in for a little case." And sure enough, they did leave me in the water right there. Until this helicopter, to me, it seemed like minutes. It seemed like I was in the water for hours. But once I came out, it seemed like within seconds. The helicopter landed right at the edge of the beach. The beach was already cleared.
Wow!
They slipped a board under me and literally right into the helicopter within...
Like a pizza with a spatula. They flipped you in.
Exactly.
And then they lifted you right up.
Exactly.
And you got to the hospital like within minutes.
Exactly. We went to Nassau University Medical Center, which, if you're familiar with Jones Beach, it's literally on the other side of the bay. And within minutes, I was now being wheeled into the emergency room. And that's when the next phase of heroes came to me.
Now, you had a physician who came to you. Was it orthopedist?
The orthopedic surgeon actually was several hours later. Immediately, when you go into the emergency room, it's your first care attenders, your primary response team. They're trying to assess what kind of damage was done based upon what you are or are not able to do. Mm-hmm. I went right into a battery of tests, and I can say that from the point that I was sitting on the side of the beach, that's where the pain started hitting me. When I was underwater, I was thinking different thoughts, and I really wasn't in, I can't say excruciating pain. From the point that I got out of the water, that pain was coming really heavy.
Where was the pain? In your head?
Right in my neck. Right in my neck, as if somebody had taken knives right into my upper back and neck.
Could you communicate that you were in pain?
Yeah. By that time, I was able to speak. I wasn't able to move my limbs, but in speaking, they immediately wanted to give me morphine and kind of knock me out because they knew what kind of pain I was in. But I was so panic-stricken that I was paralyzed that I didn't want to be out of it. So I kept telling them, no, look, can't we start off with Tylenol?
That's very funny.
Wow.
Silly me. Yeah, they said, no, you need something stronger than Tylenol. And they did. They didn't sedate me, so I was out of it, but they kept me enough with it during all of my MRIs and CAT scans. And the crew at Nassau University Medical Centers, you can't ask for a better trauma center. Once you were declared a trauma case, they were on every piece of your body assessing what may have been damaged and what course of action to take. Now, when they take those CAT scans and MRI, they've actually got remote film going right to the doctors. The doctor was at home out in Suffolk County.
And he saw it on the internet.
And this was a holiday weekend, and he's looking at these films saying, no, I got to come right in. And that's where we go to the next stage when the doctor arrives, the surgeon.
When did Kathy get involved? That's a bit later?
Absolutely. After I already had, the doctor came in, put me in traction, one of those halos that they screw into your head. You spent a few days like that. Went through 2 surgeries on September 11th.
To do what?
Well, I cracked my neck in 2 places. I broke my neck in 2 places, and one was able to be repaired. They sliced the front of your neck to assess the front piece, the back of your head to go at the rear, and I actually have 2 plates front and back that are then made of titanium with titanium screws that go through in both directions, and that was all done by the surgeon, Dr. Thomas Mango, at Nassau University Medical Center. And then once you're able to, I was lucky enough, within a few days, you sit up in bed, and before you know it, you're able to stand. Before you know it, you're able to take a few steps, and I was definitely driving myself to do what I can as fast as I can.
How much time elapsed from the time you had the surgery till all of a sudden you started to regain mobility and use of your limbs?
Oh, certainly to a small extent. By the following day, I was able to wiggle my toes, wiggle my fingers, and then slowly but surely over the course of the next 2 days, I was able to stand and take some steps. And as soon as I walked the hallway, they said, we got to get you out of this hospital as quick as possible because we can only do damage to you from this point forward.
Wow. Okay, and that's when this lady came into your life.
Exactly. Well, that's out of a 3-month stint from September 11th to Thanksgiving. I was just on a complete bed rest. I was in a solid brace, and literally the only time I was able to take it off was to shower in. I had to have my family members feed me. My son Sean at 7 was feeding me mashed potatoes and gravy. My son Kyle, I had family members come over to shave me in the morning. It was a humbling experience, but I made it through all of that. And on Thanksgiving week, they said, you know what, you're ready to start some physical therapy. Let's find a good physical therapist. And that's when I found Kathy.
What was your thoughts when you first met Ridge?
Well, it was funny. I had a new patient evaluation set up, like I do on a daily basis, looking forward to the new patient.
Not really knowing the extent
Not knowing the extent, not knowing the history, just knowing this is someone with a cervical spine fracture. Rich comes in with his wife, Patty, and from the moment they sit down, Patty says, "Now, I just want you to know, we're not sure what we're going to do yet. We're just coming to talk to you. I'm very concerned. You don't know the story. Let me tell you the story."
And then you heard.
So she went through the story, and she said, "Why should we come to you?"
Really?
And at that point, I had to say to myself, yeah, why should they come to me? What do I have that's going to convince them that this is the place for them? Because when you walk into a typical orthopedic physical therapy setting, you don't see the cervical spine fracture patients that you would typically think you would see. These patients go to a rehab facility where they do neurologic conditions. I have knee arthroscopies and ACL reconstructions, people trying to return to basketball, soccer, kids. So I had to take a step back and say, okay, well, I think because I know what I'm doing. I've seen people who've had surgical surgeries before, and I feel I can get anyone back to at least close to their previous activity. So I think you should be here because I'm not going to leave him alone. I don't have private rooms where you're going to be left in that room for, 20 minutes, a half hour. I may or may not have supervision for you. I may or may not know if you completed your exercise. But after hearing the story, I said, I'm determined to make sure that your husband gets the best care that he can possibly get, because this story is amazing. To me, absolutely amazing. And that's what I did.
And obviously he did, because here he is sitting here telling the story and, not being, what did you say, refuse in the Jersey Shore or something like that, with all the needles that they got on the beach and everything there?
Shore debris.
Shore debris, right. Look at this guy. That's Long Island. I told him the Long Island stuff is coming to shore. What did you do? What kind of physical therapy? What did you do for him?
Yeah, the first thing I did was research. Absolutely.
Research, yeah. This isn't a usual case.
No, it's not usual. It's not typical. I had an idea of what I wanted to do. I just wanted to make sure that that's my plan of action was the course that I should take. So the first few times Rich came in, my goal for mainly post-op patients is swelling. Let's get rid of any swelling. And swelling isn't something you always see. It's usually underneath, and it's within the joints. It's within the body part. So I said, first things first, swelling. Because if you don't get rid of swelling, then you can't expect the body to do what it needs to do. And his focus was motion. He came in, and he said, I can move about this much. This is about it. And that's when I knew I had my work cut out for me.
Did you say to yourself, being a professional in this field, and knowing the scope, saying, this is a big deal?
Yes.
Okay. You didn't say, I've handled this many times, and this, we see this all the time.
Yeah. You say to yourself, I can do this. I've seen this. This is going to be routine and easy. But you know deep down that every patient is completely different from the next. That's first.
Right.
And then you assess them. And you look at their motion, you look at what happened, you take their background, their history, their story. And I said, wow, I don't know what he's going to wind up with. I don't know how far I'm going to be able to take him or how much he's going to get back. And that's the challenge, because as much as you plan, as much as you know, you never really know what the outcome's going to be. It's a process.
Well, it's not. Look, what I do, for example, patient sits in the chair, opens their mouth, and I do their work. I know what the process is going to be, but you now have a big variable. Him. Right. You know his will, his motivation, his desire to want to come back.
Absolutely.
to function is variable.
Absolutely.
But obviously it worked. So how many days a week did you work with PT?
I was going in 3 days a week, and we'd spend anywhere between an hour and a half, 2 hour sessions from Thanksgiving all the way through last week. Last week I reached 80-degree rotation. Sorry for the cracks that you might hear as I do that, but
You look like Ed Sullivan here.
I
hear.
I can get. I am more limber today than I ever thought that I would be able to be.
It's incredible.
And we just dropped down to 2 days a week. So if you stay with it, you do get progress. And Kathy was very motivating. And actually, I should tell you that being in the Manhasset area, there's a whole bunch of healthcare professionals in that region.
Yes,
so
yes.
you had a long list of physical therapists that you had the opportunity to go to. Luckily, with my downstate connections, I was able to shortlist that and interview half a dozen or so. And even after interviewing them all, I selected professional sports, orthopedics and sports physical therapy, and Kathy in particular is who we scheduled with, because I said, I think she can do it.
Well, yes, but you did it. She can't move your head. You've got to will it to move your head. So obviously she motivated you, and you motivated you, and I'm sure, having met your wife, she would kick your you-know-what if you didn't do it, because she's a tough lady. So, I mean, I think that's great. It's TV, I can't say the word, but...
But I had everybody in that network, whether it was, when we came home from the hospital, family, friends, that for that first couple of months that were cooking dinners for us and bringing us through a real difficult period.
Very fortunate.
It's a very caring community, the network of friends and family that we had. Every part from the Jones Beach lifeguards, from the couple that saved me, whom I still don't know who they are.
Maybe after the show you might find out.
Maybe, hopefully so.
Nice.
The Jones Beach lifeguards, the crew at Nassau University Medical Center, Jerry Gino down in the MRI room, all of them right through to today have made me a success story. Really,
that's wonderful. And the interesting thing here is that after we met at the restaurant, and then all of a sudden we find out, this is a great cap to the story, is that purely by pure serendipity, it turns out that Rich is my son's coach in baseball when it starts now, and the season
Small
opens.
world.
And, well, small world, number one. But number two, that he's able to do it. That he's able to do it, as opposed to sitting in a chair, looking like God knows what, and not be able to function.
Yeah, I was determined to get back on. Life begins when the season starts.
Life begins when the season starts. Absolutely. I just think it's an amazing story of hope, inspiration, will, and determination and perseverance, never saying no, seeing where you feel you need to be, and then getting there. I mean, I don't care what it is you want in life. People watching this show right now should appreciate that it really doesn't matter what it is that you want, whether it's a job, whether it's learning to read, whether it's learning to sew, or anything more in your life. It's all those qualities that you exhibited, and by having the right people around you. But it really all comes down to you, and you did it. And truly, my hat's off to you. I mean, I'm thrilled and happy to know you. Glad that you know that you're going to be my son's coach, so we'll get a chance to speak more, obviously. But I think this is a great story. We're out of time. In about 20 seconds, 10 seconds, what parting comments can you make to give some people at home some inspiration?
This kind of accident could be devastating, and it could be a downward spiral. I'm fortunate enough to have pulled through a miracle. Prayers work, miracles happen, life is great.
You're the miracle man. Absolutely. Any parting comments in 10 seconds?
Don't give up hope.
Don't give up hope. Absolutely. Terrific. Just terrific. Miracle man, Rich Bentley.
Thank you, Harvey.
Keep it up. Keep going. Kathy Citarella.
Thank you.
Thank you very much. I appreciate you taking the time to come down and share this story. I hope that you appreciated this story. And whatever you do, of course you're going to do it with passion, but be smart about it and think about it, think things through, and I'm sure whatever it is you need to do, you can do it. Just look at the Miracle Man here. Dr. Pass is saying so long for now, and until next time, show passion.